Good evening, everyone. I'm very excited today because I'm going to be telling you some stuff that is going to be great. And especially I've got some good news for you, which I'll be going through. And I've just realized a mistake on the slide. So it's exactly 8 o'clock. Welcome to this webinar series. My name is Fahim. I'm a pharmacy prescriber, contractor. I work at Amy's Pharmacy, Bicester, and I'm also the founder of MedLearn and was voted the Pharmacist of the Year 2019. And I've realized actually that this is no longer correct because I'm not a finalist anymore. I actually won the award. So I won the Pharmacy Business Year Awards for Innovation Entrepreneurship 2021. So that is now incorrect. I'm no longer a finalist. I'm the award winner. So just want to shout out to everyone who supports me on this channel. Please subscribe, like, and share. Thanks for being here today. Also, I want to shout out to the doctors, the clinicians, everyone who's been supporting me. So thank you very much for this. And big thanks to the Pharmacy Business Awards for organizing everything. But today's lecture, we're going to be focusing on cellulitis, and we're going to make it straightforward. We're not going to make it difficult. We're not going to make it hard. We're going to really enjoy this time. For all of you guys that are here with me today, we're going to really just work through this together and really understand this. So welcome to this class. Quick disclaimer, really straightforward, that I'm acting in a different capacity today. I'm not acting as a pharmacist, although I am one. I'm delivering this lecture more on teaching purposes. So if you're someone sat there right now who may have cellulitis or you're feeling unwell, you need to stop watching the webinar and you need to get yourself to a clinician, whether it's a pharmacist, a nurse, or a doctor, but you need to get it sorted. So please don't wait for my 30 minutes. Get out there, get it sorted. So the conversations that we have here today are for teaching purposes. By no means they're to be used for diagnosis. This is for teaching purposes. So just a quick reminder there. The webinar is straightforward. We're going to be talking about cellulitis. We're going to be talking about how we as medical professionals think about cellulitis. What is cellulitis? By the way, from the outset, it has nothing to do with that cellulite that you might have heard of. You know, when you don't exercise and you start to develop that on your legs, it's not that. That's cellulite. This is cellulitis. So we're talking about something different here. Please remember that. We're going to be summarizing the causes. We're going to be summarizing how we as clinicians diagnose it, and I'll answer your questions. So any questions you have, leave them on the comments. I'll also ask you a question at the end for you to answer. Let's make this interactive today, the discussion we're about to have. We are planning to spend around 20-25 minutes together. I know it's a Friday evening. I know you folks want to be out there. I'm not too sure what you're going to be doing out there right now because of COVID, but you know, I'm grateful that you're here today, and we're going to be spending about 20-25 minutes to just whiz this through and get through some points. And hey, check it out. I've changed my slides. In my last webinar, I had the old slides, but this is it. That's me. And I'm super duper happy to see that there. But started my career in 2010, 2012 became one of the pharmacists or co-founders of Amy's Pharmacy, set up a second branch in 2016, voted Pharmacist of the Year 2019, 20, was a judge in 20, couldn't apply for the award, was a judge, and in 2021 was a winner again. So thanks for supporting me, folks. So let's talk about cellulitis. Like, what is cellulitis? You know, you may have heard of it, or unfortunately, you may have suffered with this. What is cellulitis? And I'm going to throw some medical jargon at you, and then we're going to break it down and just totally destroy this medical jargon, right? Cellulitis is strictly an acute, subacute, chronic inflammation of loose connective tissue. Friday night, seriously, Fahim, you're going to throw out as words like acute, subacute, chronic, inflammation, and then loose connective tissue? That is a curveball. We're not doing that. We're going to get rid of all of this. We're going to get rid of all of this. And what we're going to do to make it a lot easier is we are going to do this. Forget it. We're going to ignore that slide. It's not there. And we'll discuss that in a second. I want to make it easy for exactly what it is. And what I want to do for now is I want to block that off. I want you folks to be focusing on here. That's what I want you to be focusing on. And what I want you to remember right now is the skin can be divided into various layers. Simple. Just like I've got these scrubs on, below I've got a vest, and then you've got my skin. So we can divide it into layers. Similar here. We have this layer That's called the epidermis. We have this layer that's called the dermis. We have the fat or the subcutaneous tissue. That's the stuff we don't like. Ooh, that's not right. That's the stuff we don't like. And we've got muscle. So ignore the muscle for now. We don't want to worry about this. But we can focus on this here. So we've got the epidermis, we've got the dermis. These are just names, folks. These are just names. So don't worry yourself too much. These are just names. We love naming things. In science, we love naming things. Just like this is my MBA book. This is my phone. We name things. Same thing with the skin. You know, if there's a problem with the skin, you have to name it. And we name it here. The top part, which is what you see, is the epidermis. As you start to go below this, you have the dermis. And then below that, you have the fat. And what we're saying is cellulitis is this condition which actually affects the deep layers of the dermis. So if you have a look at this, this is where the dermis starts. Let's not panic now, folks. Let's not panic. Have a look. This is where the dermis is starting. Around here, the dermis is starting. And that's not the straightest line that I've actually drawn. There's the dermis starting here. So it's actually a problem with the deep layers of the dermis. As you can see, it's the deep layer. So the dermis starts here, but look at it, extends all the way deep, and it extends all the way into this fatty tissue. That is cellulitis. It's just an infection or inflammation. What is inflammation? Inflammation is just a term that we use that tells us that your body's responding to disease or your body's responding to trauma. For example, if I got this and went ping and hurt my finger, it's going to become red, it's going to become hot, it's going to become inflamed. That's the body's way of saying, hey, Fahim, something's not right, we got to fix it. That's all it means. So cellulitis is just inflammation of the deep layers of the dermis. So there's these layers, this is all very high level dermis, so we're not that deep yet. But once we start to go below here, and I can draw this region out here, you can see that this is going quite deep now. So once we go back here, we're getting deep. Now, what kind of color is that? It's not going to show much. But this is going to show it. Here you go. The deep layer of the dermis. Look at that. That's the deep layers. And then we go even further into the fatty tissue. Fat was always a problem. And look at it now. It's causing us problems again. So that's what that is. And this can be something that happens for a short duration or something that goes along for a bit longer or longer. That's it. Now what we can do, folks, is we can now remove this. Let's understand it now. Cellulitis is strictly acute. So it could be acute means it's happened suddenly. It could be a bit longer than suddenly, or it could be long term. And what it is your inflammation. So it's your body's response, mainly affecting this tissue here, this fatty tissue, which is also you can think of that as loose connective tissue. Don't worry about what the word loose connective tissue means. All it means that some cells that we have, when they're joined together, they're joined in a loose manner. That is it. I'm not going to go into scientific jargon, go into depth. This is just making it very top level stuff. And that is it. Isn't that definition really easy? I don't know why we have to make it complicated. We could explain it like that, right? This is explaining the same thing to you. As you can see, you've got cellulitis look at that. It's very deep. It's affecting the deep layers of the dermis. So you can see it's below here. So there's the deep layers of the dermis. And then it's mainly affecting this loose cells or this loose tissue, as you can see. And that is cellulitis. That is it. What is it caused by? Let's get into that in a moment, right now. Check it out. Before we get into what causes it, it's mainly caused by bacteria. Bacteria. So our good friends bacteria will get involved or will cause this problem if there's a break in the skin. So right now, as you can see, hopefully, my skin isn't broken, so they can't get inside. So that's one way. You could also get this if you've actually got an infection or the bacteria already in the blood. So let's say you're suffering with an infection already, and they can then travel to other parts of the body, and you can get it that way as well. But we're going to focus on the most common way, and that is where you've got your skin that gets broken. How can you break your skin? Let's have a look. So one way to break your skin would be if you were to fall, like this gentleman here. That's one way. Another way would be if you've had a bite. So another way could be if you've had a bite. So think of all the ways that you can break your skin. Bite. So if you've had some sort of bite from an animal bite or a a sting, maybe you've grazed it. You're taking the dog for a walk and you've grazed it. You've grazed your knee. You've opened it up now. Another way could be that you maybe you've had some sort of you were cutting something and you've caused a cut. So again, some sort of trauma. You can see that it's not difficult to get a break in the skin. Another way is those people who suffer with skin problems that already cause the skin not to be as good as it should be, such as eczema, because people who suffer with eczema have broken skin. So that's going to be one, or other skin infections. For example, if you're suffering with fungal infections, and actually fungal infections of toe. Look at my spelling. Friday night, fungal infections. And the biggest cause that we find is actually it spreads from the toes. What we find in the textbooks is that apparently normally where this infection gains entry is the toes. So what happens is, I'm going to try to draw this out. Here you go. There's my feet. 1, 2, 3, 4, 5. Looks more like a hand, right? But that's my feet, by the way. And if I've got a fungal infection here, let's say we've got Mr. Fungi who's inside enjoying himself. Yucks. You can now get a break in the skin. You've already got a break in the skin. Anybody who's got athlete's foot has a fungal infection knows that between the toe webs, it can become broken. And now our good friends, bacteria, can see this. And here they are. And they're not that big. And now they're thinking, great, let's go for this. And they can make their way inside. So that's why as clinicians, it's really important for us to examine different parts of the body to see how this gained entry. For us, what's important is, how did this bacteria gain entry? I don't get it. There must have been something that happened. Did you get it from inside? Not that common. Or did you have a break in the skin? Something must have happened to get this inside. Also, other things that have been linked to it is obesity. So obesity has been linked to it. Now, this guy should be paying attention to what he's eating. I think he's like me. He's having rice. Don't know why. He's got a drink. Maybe it's Coke. But obesity is a problem. If you get recurring cellulitis, you get it. That's a problem. If you've got issues with circulation, that can become a problem. So there's a lot of things that can cause this, but the most important for you to remember is a break in the skin. So when you visit your pharmacist, he's going to ask you, hey, did you have a break in the skin? And you're going to say, yes, I did. And then what's going to happen is he's going to say, okay, fair enough. Once he established that, then he's going to go into commonly what we see to identify this. So what do we know? We know that it seems to be more common in people aged between 40 and 60. I don't know why. Male tend to be more severely affected. I don't know why, but that's what they find. Fair enough. Interesting. What we find is we're looking for this. We're looking for the very, very classical. This is textbook. You don't see this. This is textbook. I mean, this is just too textbook. You don't see this, but that's what you're looking for. You're looking to see, has there been a break in the skin? Number one. Number two, is there any heat from the area? Is there any pain? Is there any swelling? Is there redness? These are the classical features. Classical features, what you're looking for. Classical. And then you're thinking, how did you get this? Well, I had a break in the skin. How do you think I got this? Easy. And that's it. That is literally what we do. We just find out, okay, what's causing this heat, pain, swelling, redness? What could have caused it? And if it's not that, then opens up another can of worms. We're not going to get into that, but that's literally cellulitis. It's like, when I was preparing for this, I thought, great, this is going to be easy. It's the easiest topic I've covered. I don't have to prepare for this because it's so straightforward. And what you're looking for is my skin becoming hot? Is it painful? Is there swelling? Is there redness? If there is, make your way down to your pharmacist, folks. Could be a problem there. So that is pretty much it in a nutshell. And what we like to do, actually, some tips is we like to draw around the area. So we like to draw, for example, here with a marker. And then we're looking, is this swelling spreading? Or this redness, is it spreading beyond that line? Let's say you've come into my pharmacy in Bicester, Oxford, and you've had this problem, and we say, okay, I'm going to mark around the area, and then I want to know in a couple of hours, within a couple of hours, how much has it been spreading? Does it stop spreading? Because if it's still spreading, think about it, it's not a good sign. That means that infection is spreading fast, and we've got to deal with it with some heavy duty stuff, folks. So that's why that gets important. So you can draw around the area, and we can see how you get along. Treatment options, very, very straightforward. The first thing is general advice. And what I've realized is my laptop is about to die. So I'm going to put pause on this. I'm going to get my laptop charger. Give me 2 seconds because I've just told now I'll be back in 2 seconds. I'm back. Right. Apologies. That was not scripted. That was not part of the plan, but I'm back. So some general advice. What's some general advice that we can give you? First of all, drink plenty of water. Stay hydrated. That's the first thing. Drink plenty of water. Plenty of water. Stay hydrated, drink plenty of water. The other thing that we can tell you is we need to get that fluid to come down. We need to drag that fluid down. So imagine it's your feet, or you've got a problem here. We want this to come down, and we want to drag it down, get that fluid down. We want gravity to pull it down. And this is important because you can see that there's an angle and it's going to flow down. This is wrong. Imagine this poor chap looks like a female. This poor girl's got a problem here. Where do you think the fluid is going to drain? Do you really think it's going to make its way that way up and fight against gravity and then come down? No, it's not. That's wrong. That's not what's going to happen. In actual fact, what's going to happen is it's going to stay right there. So if you're going to raise your feet above the heart, and that's what we say, imagine this is let me draw the lady out now. Here you go. Imagine the heart sits here. There you go, there's the heart. And you can see that that area is raised above the level of the heart. You can see? Look at that, perfect. And now look, there's an angle created and all that fluid can drain. Here on the other hand, this lady, and there's the heart again. With this lady, it doesn't look like that, does it? Have a look. It's in level with the heart, so it's not draining anywhere. I got this, these guys actually selling these pillows, by the way. I'm not too sure what the company name is, but they're selling these pillows. I'm not actually working for them, but they're selling these pillows, which are quite cool. But that's what you're going to tell you. That's what we will tell you. That raise your leg or the area above the level of the heart. If it was the arm, we want to get it above the level of the heart so it drains. That's what we're looking to do. Plenty of water, get it above the level of the heart. If there's any problem with your skin, we address that. Then we look towards treating the infection. And this may involve antibiotics. Normally it does. Well, normally always does. And we control the pain. But please remember with antibiotics, we're having a big problem with antibiotics because of these bacteria now becoming super clever and they're becoming resistant. So we've got to be careful with this. So, but we give antibiotics normally for a week, and you should get a response within 24 to 40 hours. That's how good it is. And we control the pain itself. Pretty straightforward. What we need to make sure is that you're well. So hopefully you don't have a fever. Hopefully you're not feeling extremely unwell. That's when we start to panic. But otherwise, if you don't have a fever, you're feeling well within yourself, you know, this is not spreading everywhere else, you've had some sort of break in the skin, easy. If it's an animal bite, dog bite, human bite, it's a totally different concept. We have to treat that separately. But if you've fallen on the floor, or you've had maybe a wasp sting or a dragonfly or something that's bitten, or you had some sort of trauma, pretty straightforward, folks, to deal with this. Pretty straightforward. That's essentially what we do. And then we ask you to drink plenty of water and reduce that swelling by getting the area above the level of the heart, and I've explained that to you. Let it come down properly, easy as you like. Within 1 week, job done, straightforward. But this is all on the basis that you don't have diabetes, you don't have a low immune system, that you're well. It's very, very top line what I'm telling you, very straightforward here. Summary. The reality is there's not much to summarize other than seek medical care, because this needs treatment. If you don't treat this, this is going to spread, it's going to turn into a problem. This is for sure. So if you've had a bite and you've tried your antihistamines and it hasn't worked, then go see your pharmacist. He can certainly help you, or your nurse or your doctor. And that is it. Cellulitis wrapped up in a nutshell, and I've done it in a record time of 20 minutes. So what I'm going to do now is I'm going to go on my channel to see if there's anybody got any questions. You can leave them on the chat. Otherwise, what we can do is you can absolutely enjoy your weekend that we have. And you know, it's going to be great for you to have some, enjoy your weekend. I have someone high, when you get to it, will be useful tips on how to decide between IV and oral antibiotics, and when to admit to ED, the CREST guidelines, stage 2, consider community IV if such treatment service exists. Right, so that's a good question, but that's beyond what the scope of the lecture is. The question is talking about stage 1, stage 2, class 1, class 2, class 3, class 4 types of cellulitis. This is where the infection has started to spread. And then in some cases, we consider IV antibiotics and we deal with things differently. So we're not going to get into that. We're not going into that depth. This is very, very overview. So we're not going into that. But the point to remember is that if you start to become systemically unwell, or you're unwell, then what happens is, or you start getting a fever, temperature spreading, we refer you back to your doctor to look after this, or a specialist or specialist pharmacist. So normally GP or a hospital, even a GP will refer you to hospital if you become unwell, and then we leave it for the specialist to do. We're not going to start to go into huge guidelines today and bore you guys to death with the CREST guidelines and start to look at, various types of antibiotics, IV. We don't need to worry about that. So I'm going to leave that for now, but a good question nonetheless. And any other questions you have, put them on the chat, and I'll answer them as we go. But remember, this is we're keeping it very basic. We don't want to scare our patients with IV antibiotics and so on. But certainly I will, if I get a chance, I will answer that for you. And no more questions. So thank you very much for being here today. Really appreciate that. Subscribe, like, and share to the YouTube channel. Stay safe, folks, and make the most of your time. Thanks for being here.